Welcome to a Brookwood Baptist Health exclusive interview. My name is Brian Pavlik. I am joined today by some wonderful clinical educators for our market education here at Brookwood Baptist Health, Jennifer Morales and Tiffany Hutto. Ladies, good morning and happy Heart Month to you.
Morning, happy Heart Month to you.
Absolutely. It is February. We have now rolled into that calendar. So of course it is all about Heart Month. And we are going to talk about a topic that I think everybody has a concept of. But if you're like me, you heard this term in elementary school, probably heard it again when you had to take a class for something like a camp counselor type thing in junior high or in high school. And then really it's just kind of, I guess I still know it. And that, of course, is CPR. And here we have two of the best in our business who are going to reintroduce CPR to us, tell us a little bit about it, and then give us a physical demonstration at the end of our interview today on how to do what we're calling Hands Only CPR. So ladies, I'm going to jump right into this because from stats, I have a stat from the American Heart Association website here. Every year, 475,000 people, all right, that's a lot of people, die from cardiac arrest in the United States. All right, we're almost talking 500,000 people. All right, and we know that one of the first steps in hopefully saving these lives is CPR. And as I told you, in elementary school, I was introduced to this term, CPR. And in the back of my mind, I think I know what it is, but just quite simply, what does CPR stand for and what is it?
So CPR stands for cardiopulmonary resuscitation. What it is getting in and starting to help save that person's life. You're getting their blood working and flowing through their body again.
And I saw too where immediately, like if we get into action immediately, we can double or triple chances of survival. Yep. This is still an accurate statement of getting there early if we can?
Yes. The sooner that you start CPR, the better chance that the patient has to, or person has to survive.
Absolutely. And we'll show you again how we're going to do this and how the new techniques and kind of this hands-on, we'll show you here in just a few minutes here. But, here I am. I'm the average Joe somebody in a marketing department for a healthcare system. I don't have an MD to my name. I don't have an NP to my name. I have no credentials. Okay. So therefore, I'm immediately going to say I'm unqualified to do anything health related. However, if I'm at a restaurant, a movie theater, a ballpark or something, and I see somebody going into this cardiac arrest or struggling, and we need to get into, emergency saving immediacy, why should somebody like me know how to perform this correctly?
Because you taking that extra step and knowing that then helps that person that you see out in the public might have just slumped over, passed out, had that gripping their chest and fall out on the floor. You then help that person double or triple their chance of actually surviving that event. Where if no one does anything, the likelihood of that person making it to even come here to the hospital or any hospital and making it through an actual code when they make it to the hospital is very slim. Compared to if you see this person and you start just at least doing compressions, which is the hands-on portion only, it doubles and triples the possibility of that person making it.
Absolutely. And of course, as I, the average Joe somebody, start, but wait until that professional medical help comes, whether it's through 911, ambulance, medical services, or something like that. So it is important for the public to know how to do it correctly and when to jump into it. And we'll talk about that here in a second. And again, I'm talking with Jennifer Morales and Tiffany Hutto. They are clinical educators for medical and market education here for Brookwood Baptist Health. And they've been so kind to join us today to talk about CPR, what it is and how we should do it these days, especially in COVID times with a hands-on training. We're going to get to that here very shortly. I promise you. I'm going to get a little cynical here now because I'm of the millennial age, right? Or the Gen X. I don't know which one I am. I get confused. So my parents' generation, we had shows like Candid Camera. And my generation, we grew up on Ashton Kutcher and Punk'd. And now we have kids with social media and they're doing these weird stunts and things for likes and shares and all that. And yeah, sometimes, ladies, I'm going to be honest, it's hard to tell when there is a real serious situation. And it's not just people just goofing around for likes just to see how people react. So when it comes to cardiac arrest, how can you tell, or can you even tell, this is a true serious situation and not just some goofballs using this situation to get likes or shares on social media.
Mhm. So the best way, so I'm a female.
Mhm.
I've always learned as a female, because I don't want to put myself in a situation that I get injured trying to be that person that helps someone. I have learned, instead of reaching, because they used to teach you, get down and you tap a person. Hey, Annie, are you okay? Mr., Mrs., you okay? So I've learned, if you don't want to get up and do it that way, you can go up and use your foot towards their leg and tap on their leg and push their leg and, hey, Mr., Mrs., you okay? And if they don't respond, more than likely they're not trying to punk you or trick you. But if you don't see their chest rising and falling, if you want to reach and grab their wrist and see if you can feel a pulse, even if you grab the wrist and they drop it down, more than likely they're not faking.
Mhm. Okay, so good tips there. Poke them. You know, if somebody's playing around, they're either going to get ticklish, they're going to move, they're going to respond, their eyes are going to open, whatever, something like that. So if you're poking them and you're giving it a little bit of force, great advice there. Maybe with the foot, you know, a harder kick, not, you know, bruising kick, but something that's going to definitely wake somebody up if it is forceful enough. So that's great advice. So using that kind of first step. And now we get into it, ladies. So here we go. Obviously, first step, we're going to direct somebody to call 911. I know you guys would recommend that immediately. So if you're that person kind of taking the point, taking the charge right now, you're going to direct, hey, you go call 911. Now, again, growing up, I was told the whole tilt the head back, close nostrils, blow, all that. Now, as we have now been in COVID days, and I think even before this, we're getting more comfortable with the transition to this hands-on technique that you guys are going to demonstrate here. So if you don't mind, and let's address this as we're going, because this is the question I've been wanting to ask you guys. I love the show The Office. Yes. And if you have seen that episode of the failed CPR training, you know exactly where I'm going with this. And I'm not going to reenact the whole thing. Of course we could, but you know, this is just a 10-minute interview or so. The fun thing that the CPR instructor teaches them is you got to do the compressions to the kind of the beat, the rhythm of staying alive by the Bee Gees. Now, we won't call that medical and clinical advice. However, how accurate are we there? And if you don't mind, just go ahead and take over from here and show what is the new techniques and what are some things we can keep in mind as we go. I'll kind of lay up a little bit and let y'all kind of go from here for a while.
Okay. So I do want to stress, yes, you want to make sure that you call someone out to go get or call 911. When you're in that situation and you have a crowd of people around you, I want to stress, don't just, hey, someone call, look up. You see someone, hey, you in the red shirt, call 911. Because when you do that, it's actually forcing someone to acknowledge you. You need someone to acknowledge that they're doing, because if you're telling someone call and you're thinking someone's calling, they might not have. So I'm going to flip our camera here.
Yeah.
We can.
And as you're doing that, I must introduce the third member to our party. The mannequin we're going to be performing on is Annie. And as you see behind you, Annie, are you okay? Of course, Michael Jackson. Yeah. That reference. But yeah, we'll let you guys go ahead and take over with Annie here.
So Tiffany is going to show you some good high quality compressions. So what you want to first do is when you come up to someone, you've shook them, you said, hey, are you okay? Are you okay? They're not responding. You're checking for a pulse. You're not feeling anything. You then want to take your hands and go up your rib cage and go pretty much in between the middle of their breasts or their chest on that, what's called the sternum. It's the harder part. And then you want to make sure that you, as Tiffany is showing, her fingers are interlocked. She's got her arms straight. We want them straight. And then she's going to start doing compressions. And yes, you can still do it to the beat of Staying Alive, but Tiffany and I like Uptown Funk. Uptown Funk will work also, or Tiffany's ultimate favorite, Baby Shark. So as you see, Tiffany is going, she's not really going that fast right now because she's demonstrating, but in real life, you want to go to the beat and go a little faster.
Sure.
So, and you're going to feel their chest go down and up. And this is what you want.
Ladies, let me ask you, as you, and you know, Tiffany, you don't have to keep going if you don't want, but we understand. Thank you very much for that. You know, as you were saying about the whole, you know, the compressions, I appreciate Uptown Funk and Baby Shark. It's just something else if that's on your Spotify playlist these days. We were told again, I'm going back now because some people may not know the new techniques and things, because again, people were so used to plugging the nostrils and blowing in and all that. Is there an amount of compressions where you should stop? Now, obviously if the patient starts coming to, I believe that's when we stop. But let's just say we're pressing. Are we expected to keep going until medical personnel arrives, or should we count to a number, take a rep? How does that work these days?
So you want to keep going until a medical person comes and arrives, or if someone else in the crowd offers up to help, that you can swap out because you're getting tired.
Right.
But you really should, when you start, you should keep going until either the person has come to, or a medical professional has, your EMS has come and gotten to the scene and they're helping out.
Incredible. Listen, we talk about how you guys are wonderful clinical educators for us. I was educated today. Success, ladies. That was awesome. Great stuff. Well, and that's really it, folks. You know, this is something, hopefully, as you're watching this, as you're sharing this, and again, in the spirit of Heart Month and taking care of your heart, listen to your heart. And that's not just a medical term when you're a patient and you're saying, oh, I'm feeling so bad. When you are in a situation like this and you are the bystander, listen to your heart and get involved in this if you can. Because the worst thing, as the ladies have just described and showed you, is to just sit back and just assume, well, this person will make it or something like that. Do those quick little tests. Are you okay? Making sure people, pointing at specific people, telling them to call 911 and administering properly. The worst thing that you can do is at least attempt until medical people or professionals arrive. And I think that's the goal of this whole thing. So ladies, I really do appreciate your time. I hope that everybody who has watched this today has learned, has kind of grown in their knowledge of why CPR is important, why we are called to be, you know, we're called to look after each other, folks, in this world. And especially these days, we really need to do that. So in the spirit of Heart Month, ladies, I appreciate all that you do, not just for heart education, but just for clinical education. Again, I was talking with Jennifer Morales and Tiffany Hutto today. Wonderful examples of why Brookwood Baptist Health continues to be just a wonderful company that just continues to portray just wonderful patient service, but also Christ-centered focus when we're treating with our patients. So ladies, I do wish you the best. Happy Heart Month. Thank you so much for your time. For everybody else, we will see you at another time. Thank you.